Hey guys, Mark Huntington here with Empower Kidney Warriors, and it's dialysis time again. So thought I would have you guys join me as I jump in on another video and hook up. I wanted to say one thing real quick. Doing home hemodialysis is awesome. One of the things that I hear over and over though is that when people take this on, if they have a care partner, if you're fortunate enough to have a care partner burnout is just huge. It's endemic. So, if you're on home hemo, if you know somebody on home hemo who's a caretaker, this is definitely for all of these people, definitely for patients like myself to learn to take more control, to be more autonomous, and by learning to do this more solo, freeing up the caretaker, eliminating caretaker burnout, and having more autonomy yourself. Because I'll tell you, doing home hemo, the frequency and the control, you feel better, you eat better, everything goes better on dialysis, at least in my opinion. That's been my experience with home hemo. It's been awesome. Learning to do it by yourself, like I said, it's super empowering, and it frees up everybody, not just yourself, but your care partner. So join me as I just sort of jump in today and put myself on and just kind of go through the ropes, talk to you about the basics of Dialysis 101. All right, first I'm going to slap on the tourniquet here and get ready to cannulate. I've already put on my betadine, what sterilizes the fistula, so that's had a chance to dry. Now I'm ready to cannulate. I have just a nice, good old-fashioned stretchy belt. Works perfect. Other types of tourniquets just don't tend to work as well for me. This works awesome. Arterial line. Raise up here so you can see as I make this cannulation. This is the arterial line first. We do this down below. This is what pulls the body out and into the machine. I have my tape pulled already down here. All right, make sure I have a good stick. And then move on to the next one, which is the venous line. Generally, that's the blue. To help you keep it separate, arterial is a red cap, venous is the blue cap. And here we go now for the venous line. Okay, now when you're putting your needles in, one of the biggest things is to make sure that the needles are at an angle that's conducive not only to good blood flow, but to not having pressure up against the walls. You don't want to have pressure alarms. Make sure that you angle the needles through the tape to get a great stick, a great angle so that the blood flow is good. Okay, now that both of those are in and secure, release my tourniquet here. And again, I've got my tape of varying lengths to secure my lines. One of the things that you'll learn during dialysis by yourself, and certainly doing home hemo, is the trickiest part is taping yourself correctly. So the taping is definitely crucial as you get everything set up to make sure that the lines, of course, that the needles and that the lines are angled in correctly to reduce any kind of pressure against the walls or any kind of high blood flow. So as you can see, I've got that one there, and you have any kind of a pull or pressure, especially like later on in treatment, needles can pop out and it makes a horrible mess. Believe me, it's terrible. You don't want to do that. You don't want to go there. So be very careful. I always tape it from different angles. Make sure that it is really secure. Now, this comes in especially handy if, like myself, number one, you do it yourself, so it's home hemo, you want to have a very secure tape job, but number two, I'm investigating and moving towards doing nocturnal hemo, which is doing it at night, putting myself on at night and then sleeping all throughout the night. So as I prepare for that and test that out, I'll let you know how that goes. Finish taping here. I want to also do it in a timely manner so that you can get your heparin in, prime your lines, and make sure that nothing clots. Okay, nice. I like to give it a nice push. Make sure that you have a good stick and that the blood is flowing. Now it's time to prime the line. I always make sure that I prime it really, really well. You want absolutely no air anywhere in the top here or anywhere in the lines. Anywhere it causes major problems, causes alarms. You don't want air. When you're done actually priming, make sure you clamp that. Wipe off any excess blood. Again, I prime mine really well. Abundance of caution just to make sure there's no air. You can see that one shot up. That means you've got a really good stick. The blood flow is good. Shot up to the end there. no air, clamped. Next step is heparin. Now the heparin is what keeps your blood thin during the treatment so that it doesn't coagulate in the lines. Start off with putting heparin in the arterial line. Of course, always double check to make sure everything is clamped. That is 101. If you open one of these lines, it's not clamped and the blood starts coming out, it's really quite cumbersome and huge mess to clean up. You don't want that. Check your line is clamped, take the cap off here, and here goes your heparin. Now, once the heparin is in, both of these lines are primed, I'm ready to go ahead and hook up to the machine.